Hi everyone, this is your boy Youngie, first year University of Melbourne medical student from Shepparton campus. I just want to talk to you about my experience within the last 2 weeks. First, I will talk about the assignment that I had last week and how I managed my time, and I will also talk about the clinical learning and what I got from it from the hospital. So first and foremost, what I did with my assignments, I had like 3 assignments. I had to be really organized and make sure that I keep on top of those. So one of them was based on a research, so that wasn't much complicated, but we have to read the journal articles and then go through those articles and see and critique the article pretty much. So we had to go through the article, critique the article, try to understand it, and that teaches us to be better researchers, especially when you become clinician. I think it is important for you to do a bit of a research. So it could be research in a new drug therapy, it could be a research in new treatment modality. So those are the things that you need to know as a doctor. So most of the doctors actually do research. So the Med Student Conference 2022 was really amazing, and you had 3 assignments within those. So it is more of making sure that you have the right resources to do your reflection on, also recalling what we did last month and having evidence to do that. So it took a bit of time, and that was due on Friday as well. I had a lot of other assessment due on Friday, and yes, I just had to make sure that I get those things out of the way. Our content, we had a heavy content too, so I had to get through some anatomy studies and I had to get that out of the way as well. After completing about 7 hours of online content, I also had to submit in my case formulation. I normally take a lot of time and get quite thorough with my case formulation of the week, so that was due on Friday. It usually take me 2 hours to actually get that done. I know other medical students do it within 20 minutes, but I like to take my time, try to understand what is going on with the case and what the holistic picture look like, and then just take a summary of my week, just take a summary of what I've collated and then submit that as my case formulation. So that took me 2 hours, and we had 2 patients from different background that diabetes, so we had to do pathway for them. One white Caucasian male who presented with the sign that I suggestive of type 2 diabetes, and another female from a refugee background which also have a similar presentation. However, their cardiovascular risk had to be assessed. So that was one assignment that was due this Friday as well, and took a bit of time to sit down and focus on that. What I did within medical school, I was learning the medical school alphabet, what we call ABG, so arterial blood gas. So these are the tests that we normally do when the patient come into the hospital, just to see if they have what we call acidosis or if they have what we call alkalosis. The condition that we normally see this is when the patient come in with what we call diabetic ketoacidosis, and they have to be managed in emergency, where the patient just come in with things such as asthma, or if they come in with acute kidney injury. So we normally need to do arterial blood gas to see what we're dealing with, and we manage it properly. So this was the first time we're learning it. So we're learning about how to draw the blood, like what artery we need to get the blood from, and we went through 3 types of arteries that we go through. So when you have so many things that are going on, another thing that you need to do over the weekend, you need to be organized and you need to plan out as well. So that did take a bit of time, getting organized, making sure I prioritize things, but most importantly, I had to wind down. So winding down is one of the most important things, finding things that you enjoy and things that you love. So that's what I have to share this week. So I had a really amazing time learning about the doctor's alphabets, and also getting a bit of time to hang out with colleagues. I hope you guys enjoyed this video, and I'll see you guys sometime soon. 2 kiss for now.